Morning everyone. My name is Dr. T. Kalyani from the Department of Anatomy. Today I'll be discussing on nasal cavity, its parts, its boundaries, arterial supply, nerve supply and little bit of clinical aspect of the nasal cavity. Here I am showing the sagittal section of head and neck, where now here you are seeing the nasal cavity. So this is the nasal cavity. The interior of the nose, it is divided into right and left nasal cavities by nasal septum. The nasal cavity communicates with the exterior, this is exterior, with the exterior through nostrils or nares, and with the nasopharynx by your posterior nasal aperture. The nasal cavity is divided into two portions, a smaller antero-inferior part and a larger posterior superior part, this part. Now the anterior-inferior part is called as vestibule and posterior-superior part is called as nasal cavity proper. Now first we will see the nasal cavity, the vestibule of the nasal cavity. So this particular area is your vestibule of the nose, where it is lined by the skin, and you are able to see here few hair follicles, hair, and a thick interlacing hair which is called as vibrissae, and this vestibule is covered by skin. Now coming to the nasal cavity proper, this particular part, it has few boundaries. The first one here, it is the roof, the floor of the nasal cavity proper, medial wall which is forming the nasal septum, and this one is your lateral wall of the nasal cavity. First we will see the roof of the nasal cavity proper. The roof is narrow in front and it is wider for about 1 centimeter near the cornea. The posterior nasal aperture, this particular area is also called as cornea. And the middle third of the nasal cavity, it is horizontal, where it is formed by cribriform plate of ethmoid. And anterior third of the roof slopes downwards and forwards, and it is formed by your nasal spine, of frontal bone and nasal bone, and junction of the septal and lateral alar cartilages. The posterior part of the nasal cavity, this one, it also slopes downwards and backwards, and it is formed by the body of sphenoid. This one is your body of sphenoid. It is formed by the body of sphenoid. Now coming to the floor of the nasal cavity. This particular part is the floor of the nasal cavity. It is the floor is horizontal and it is formed by the upper surface of hard palate. The anterior 3/4 of the floor, it is formed by the palatine process of the maxilla, and the posterior fourth is formed by horizontal plate of palatine bone. Now coming to the medial wall. This particular thing what you are seeing here is the medial wall, which is formed by the septum and acts as a partition between the right and left nasal cavities. It is present in the median plane and bulges either to the right side or on the left side, but most commonly it deviates to the right side. Now this nasal septum, the bones forming the nasal septum, posterior superiorly it is formed by the perpendicular plate of ethmoid, and posterior inferiorly it is formed by the ulnar bone. And the cartilages which are forming the nasal septum are the septal cartilage, which forms the major anterior part of the nasal septum, and the septal process of two major alar cartilages. And these alar cartilages, they unite in the midline to form the columella or columellar septum. this particular part, and there is a small area between the septal cartilage and the columella. This particular small area, it is lined, made up of double layered of chin where there is no bone and cartilage, and this is called as membranous septum. Now we'll be seeing the lateral wall of the nasal cavity. It is little complicated because it is formed by number of bones and cartilages. So the bones forming the lateral wall of the nasal cavity are: first one, nasal bone, frontal process of maxilla, lacrimal, the concave and the labyrinthine of the ethmoidal bone, inferior concave, perpendicular plate of your palatine bone, and medial pterygoid plate of sphenoid. Somewhere here, just below the auditory meatus, you will be seeing the medial pterygoid plate of sphenoid bone. Coming to the cartilages forming the lateral wall of the nasal cavity, they are nothing but the lateral nasal cartilage, major and minor alar cartilages. Now we'll see the main features of the lateral wall, what is forming the lateral wall of the nasal cavity. If you see here, there are few projections or elevations. These are called as concave. The concave are turbinates. They are curved bony projections directed downwards and towards the medial side. Below each concave lies the corresponding meatus. I'll tell you what is meatus in the next part. From above downwards, they are superior concave, middle, and the inferior concave. Sometimes, rarely, a fourth concave is present, which is called as concha suprema. Now, if you see the superior and the middle concave, nasal concave, they are the projections from the medial surface of the ethmoidal bone. And inferior concave is an separate or independent bone. The superior being the smallest concha and the inferior being the largest. Now we'll see what are meatuses. These are the passages which are lying underneath or beneath each concave. They are seen only when the concave is each concave is removed. Superior meatus. It lies below the superior concave, and a small triangular depression just above and behind the superior concave. There is a small triangular depression which is known as sphenoethmoidal recess, just somewhere here, this part. Now coming to the middle meatus, it presents two parts. One is ethmoidal bulla and hiatus semilunaris. Once you just flip open the middle concave, you will be able to see a rounded elevation produced by underlying middle ethmoidal air sinuses. This is your ethmoidal bulla or bulla ethmoidalis. Just below the bulla ethmoidalis, there is a deep semicircular sulcus which is known as hiatus semilunaris. This particular area, what I am showing here, is your hiatus semilunaris. Just in front or above a short passage at the anterior end of middle meatus, this particular area is called as infundibulum. Coming to the inferior meatus, it is the largest and lies underneath the inferior concave. Now we are going to see the openings in the lateral wall of the nasal cavity. The sphenoethmoidal recess. Into sphenoethmoidal recess, opening of sphenoidal air sinus, and into the superior meatus opens your posterior ethmoidal air sinus. Coming to the middle meatus, into the bulla or on the bulla, you have middle ethmoidal air sinus, and into the hiatus semilunaris from anterior to the posterior side. Anteriorly, your frontal air sinus will open. In the middle, your anterior ethmoidal air sinus will get open, and into the posterior part of the hiatus semilunaris, your maxillary air sinus will be opening. Coming to the inferior meatus, opening of nasolacrimal duct. So we have seen the openings of the lateral wall of the nose. Now coming to the arterial supply. First we'll see the arterial supply of the nasal septum. So the arteries which are supplying the nasal septum, they are septal branch of anterior ethmoidal artery into the anterosuperior aspect, which is a branch of ophthalmic artery, septal branch of posterior ethmoidal artery, which is again a branch of ophthalmic artery, septal branch of sphenoethmoidal artery right from the superior posterior side, which is a branch of maxillary artery, and greater palatine artery, septal branch of greater palatine artery, again a branch of maxillary artery, and superior labial artery, septal branch of superior labial artery, which is a branch of facial artery. All these arteries, what I have just mentioned now, all these together will supply the nasal septum. Now coming to the lateral wall of the nose, the arteries which are supplying the lateral wall of the nose, they are, first before going to the arterial supply, I am going to divide this lateral wall into 4 quadrants. Just draw a vertical line in the middle of the lateral wall and a horizontal line like this. So this one will become the antero-superior quadrant, posterior-superior quadrant, antero-inferior quadrant, and posterior-inferior quadrant. The antero-superior quadrant, it is supplied by your anterior ethmoidal artery, and antero-inferior quadrant, it is supplied by the branches of facial and greater palatine artery, which is coming from below. And posterior-superiorly, it is supplied by sphenopalatine artery, which is a branch of maxillary artery, and posterior-inferiorly, this particular area, it is supplied by your greater palatine artery. This is what about the arterial supply. Now we will see the nerve supply of your nasal septum. In the middle of the nasal septum, this particular area in the middle third of the just below the ethmoidal bone, it is supplied by olfactory nerves, and antero-superiorly it is supplied by anterior ethmoidal nerve, which is a branch of nasociliary nerve, which is further a branch of ophthalmic nerve. Antero-inferior part, this particular part, it is supplied by your anterior superior alveolar nerve from the maxillary nerve. Posterior-superior part, it is supplied by medial posterior superior nasal branch, nasal nerve, which is a branch of pterygopalatine ganglion. And posterior-inferior, this particular area, it is supplied by nasopalatine nerve, which is further a branch of pterygopalatine ganglion. This is the nerve supply of the nasal septum. Now coming to the nerve supply of lateral wall of the nasal cavity. As I told you earlier, for the arterial supply, in the same way, just divide the nasal lateral wall of the nasal cavity into 4 quadrants. Antero-superior, which is supplied by the posterior superior lateral branch of pterygopalatine ganglion, posterior superior quadrant. Posterior superior quadrant, it is supplied by posterior superior lateral branch of pterygopalatine ganglion, and posterior inferior quadrant, it is supplied by nasal branch of greater palatine nerve, which is from the pterygopalatine ganglion. Other than the posterior superior and posterior inferior part, the anterior superior and anterior inferior nerve supply is same as your nasal septum. That is nothing but anterior superiorly it is by anterior ethmoidal nerve, and anterior inferiorly it is by your anterior superior alveolar nerve, which is a branch from the not directly from the maxillary nerve through infraorbital nerve. Now we will see little bit of clinical aspect about the nasal cavity. The first one, an important feature is Little's area. What is Little's area? It is an area in the anterior-inferior part of the nasal septum just above the vestibule. This particular area you call it as Little's area, and it is highly vascular. Here the septal branch of anterior ethmoidal artery, sphenopalatine artery and greater palatine artery and your superior labral artery, all these four arteries except the posterior ethmoidal artery, these four arteries anastomose with each other to form vascular plexus known as Kesselberg plexus. This area of nasal septum is the commonest site of epistaxis. The common cause of epistaxis, it can be due to trauma or hypertension. So, and the epistaxis mostly in small children, if you see, they keep snatching or they insert some objects into the nose where they due to which causes epistaxis. And second one is deviated nasal septum. So this is your septum. So most common cause of deviated nasal septum, it might be due to developmental error or trauma. And the deviated nasal septum, it is very common and it causes nasal obstruction. If the nasal deviated septum is severe, causing the nasal obstruction, breathing difficulty and sinusitis or excessive snoring, and in few persons severe headache, it can be corrected by submucous resection or septoplasty. So mostly in males it is mostly males are more affected when compared to the females. Then one more clinical aspect is rhinitis. It is most common in every one of us. The rhinitis is nothing but the inflammation of the mucous membrane lining the nasal cavity. So the hypertrophy of the mucus over the inferior concave. Can you see here this the mucous membrane which is lining the nasal the mucous membrane lining the nasal cavity, and the hypertrophy of the mucus over the inferior concave is most common feature of allergic rhinitis. Clinically, if you see, these patients, they present the persons, they present with nasal blockage, sneezing and water discharge from the nose. That's all about a little part of the clinical aspect. Thank you.